Hi, welcome to our podcast. This is Dr. Ducheine. I've I work at Elegant Aesthetic Solutions. It's a med spa. Traditionally, I'm trained as a general laparoscopic and a weight loss surgeon. That is, I did general surgery, and I specialize in what's called minimally invasive surgery. And then I started doing weight loss for about 15 years. And having been involved in the surgical field for 30 years or so, and especially after COVID, we basically I decided to transition to something that's less taxing on the body and the mind, and I decided to also to transition into the med spa space. The med spa, medical spa, which is really a spa that perform aesthetics procedures, anti-aging, and body contouring procedures. And today we're going to talk about the lasers, the use of the laser in the med spa space. There's so many things that the laser can do. And for example, most people use lasers for things like hair removal, all right, especially based on hair growth. In other words, the client that mainly uses laser for hair removal is a young lady that's getting hair growing, or also an older woman, because currently I have a 72-year-old lady that wants hair removed from her chin and upper lip. So basically we use a laser, and you may need a couple of sessions because depending on the phase, we know that hair growth has three phases. You know, the growing phase, the growing phase, the phase where it stops, and then the phase where it starts. When you want to get into the technical terms. So depending on which phase that the hair is, and you hit the hair follicle with the laser, will determine. So that's why it's not when you hit it, it kills the hair follicle. It depends on the phase. If the hair is not growing, chances are you may have to hit it more than once. So therefore, that means that if you're going for a laser hair removal, you may need 3, 4, and sometimes even 6 sessions. Also, if you have different shade of skin, which they have a particular classification of the skin. They have 6 levels, and I'm blanking out on the name. You may have to adjust the laser also for that, because one of the problems, especially people with dark skin color like myself, sometimes you have to be very careful so that you don't get what's called post-inflammatory hyperpigmentation. That is, after you had the procedure, your skin looks a little darker than the rest of the surrounding skin. Especially, let's say if you've had a, hair or skin infection around the areas of the hair, it's a little darker. That's what post-inflammatory hyperpigmentation is. So laser hair removal is one of the most commonly used laser procedures. People usually, like we said, uses on their upper lip. They use it on the chin and on underarms, abdomen, and back. Men, for example, use it to basically outline the beard. In other words, you want a nice symmetric beard on both sides, and they would use a laser to kill the hair follicles that's growing in areas where they don't want. Not too many men like hair growing in their necks, so that would be one place. And sometimes, let's say if you're a bodybuilder, you don't want hair growing on your chest, so you would use a laser to take that hair out. And especially a lot of the Middle Eastern men, genetically, one of the adaptations that the body underwent is to have hair growing on their torso. So a lot of these guys also wants that hair removed for cosmetic reasons. So hair removal is a big use of the laser. Another use that people have is for scars. It's not as good for scars as it is for hair, but a lot of people use laser for scar removal. It's a little bit more involved, and also depends on the scar and how long you've had the scar and what other procedures or methods you've tried to remove the scars. So laser is one of the methods people have used to remove scar. It's decent, but it's not among the best. But again, it can do the work. It depends how big, how deep. And if we're talking about scars, there's something I would call stria or especially in ladies, what we call the common stretch marks. Laser does not really entirely remove them, but make them seem less obvious. So this is another cosmetic use of the laser. But even more important, let's talk about acne. Acne is a problem that usually we get when we're going through puberty, and basically the oil glands tend to become hyperactive, and they can get clogged, and sometimes when these clogged pores become infected, and they could give you basically a bad case of uh, acne vulgaris, in other words, a type of acne that's really, really aggressive and cause infection. Now, a laser we can use along the treatment of acne. Now, the laser, this what's called ablative or non-ablative. Ablative means that they basically burn the skin so that the skin is the epidermal layer, the superficial portion of it is burned off so that it can allow the bottom part of the epidermal layer to rejuvenate and start producing. That's ablative. Non-ablative is they use different parts of the epidermis. They don't do it all at once, so it takes longer for the skin to shed and to renew. So that's to say that lasers can be used in the treatment of acne, basically do appeal to also uncover and sterilize those little black pores as part of the regimen. But also along with that, you need other medication for the acne, although a lot of dermatologists use lasers for acne, but it's one of the things that, again, you can use in terms of acne treatment. Excuse me. One of the big uses of lasers now, currently, because of advancement of technology, a lot of people that snore at night. In other words, we can use lasers for snoring. And usually you, the one who snores, will not know, but people around you, significant other, will let you know that you snore. And sometimes it's a problematic thing. It's a big problem for couples or friends or even brothers and sisters, because some people cannot tolerate somebody else snoring. That's why a lot of couples, when they start, they sleep in the same bed, and after they've been together for a while, especially when you reach a certain weight. As a former weight loss surgeon, when people's neck sizes got above 16 inches, there's an 85% chance that you snore at night. You may not know it, you snore at night, and particular positions make you snore more. Most people tend to snore when they sleep on their backs. If they sleep on their stomach and head to the side, they may still snore, but at least not as much, if they snore at all. So there's a lot of things, a lot of what we call prosthesis. In other words, appliances that you make to put in the mouth to help decrease your snoring. And basically the reason people snore is because there's loose tissue in the back of the mouth. And these tissues, especially when you recline, they tend to flop in the way of the air. When the air comes out, it's kind of like make them vibrate, and that's what you interpret as snoring. Now, a lot of times also, if you open your mouth and you try to see the back of your throat, some people, they can see directly the back of their throat. The uvula, the little thing that hangs in the back of your mouth, is high enough so you can see all the way back to your tonsils. Some people, they can see partial. They can see maybe 3/4 of their throat. Some people can see half. There's something called Mallampati score that helps determine how much of the back of your throat that you can see. So people who barely can see the back of the throat, if at all, they are the ones that tend to snore more than the others. And especially as you, we say, as you gain weight, and when you become morbidly obese, again, morbidly obese people tend to snore more because they don't have more fatty tissue, more lax fatty tissue that tend to vibrate. Also, I've met very thin, even undernourished people that snore, but they tend to be the exception, not the general rule. Again, when you have your neck size above 16, and we're talking about obese people. If an athlete, like you have a marathon runner who has neck size 16 because it's big, or you have a basketball player or boxer whose neck size is 16 but not fat, the guys are lean, they may not snore. In other words, this rule I'm telling you does not apply to these people because they have lean body mass. The people with neck size 16 that may snore are people that have body masses that are associated with obesity. Again, as a former, as a bariatric surgeon, this is what I have to deal with. And one of the things that we used to have these people do all the time is a sleep apnea test. Sleep apnea is when people sometimes at night, they stop breathing. And they stop breathing and they wake up short of breath because the oxygen level in the body dropped and the carbon dioxide went up. So that sends an emergency signal to the brain and they wake up short of breath. And these people also at increased risk of sudden death. And that usually tend to be associated with obesity. So sleep apnea, something that you see a lot in people who are snoring. And these are some of the reasons that also snoring should be handled and cured to the extent possible. Now, the laser's role in helping to reduce or even cure snoring, it can cure most of the time. In other words, eliminate snoring. And it's a procedure that takes about half hour, and you may need 4 to 6 procedure because what the laser does is heats up the tissue deep in the skin and to cause collagen stimulation. As you stimulate the collagen, you stimulate the protein called elastin, and they tend to strengthen those areas that tend to flop in the back of the throat. And as they strengthen and they don't flop as much, so then the snoring usually goes away, or in the worst outcome, it gets better and people can correct their sleep apnea. And also, by the way, there is a test for sleep apnea. If you think you may have sleep apnea, there's a app. You can go to the App Store. I think the name is Snore something. And what that app will do is when you turn it on at night, it will measure if you snore. And once you snore, then you go to your physicians and then they'll do a test for you to see if you have sleep apnea. And again, sleep apnea is not a healthy thing because it can cause sudden death, more often associated with people who are overweight and morbidly obese. So that's a very important thing. So again, laser is one of the things that can help in terms of relieving or improving sleep apnea. So that's another thing that we also take care of at our med spa, because snoring can ruin marriages, can ruin lives. So, and of course, the effects on health are very, very not good. Because if you don't sleep, you tend to be stressed the rest of the day. You tend to be stressed the rest of the day, you tend to be short-tempered. You tend to be short-tempered and stressed, your blood pressure goes up. Your blood pressure goes up. One of the things that people tend to do when they don't feel good, they tend to look for ways to feel good more than other people. And one of the ways people tend to feel better is after they've had a large meal, or after they've had a good meal, or constantly having things that make you feel better. So we see that sleep apnea can be associated with behaviors that can lead people to overeat and become more obese. And you become more obese, you get more sleep apnea. It's a vicious circle. So the idea is if you snore or people tell you that you snore, you should definitely get it fixed because it's a matter of health. And if you want to feel good, that's one of the things that helps you feel good. And if to look good, you got to start by feeling good. So very, very important. In the words of Billy Crystal, you want to feel marvelous. Those of you guys that remember Billy Crystal from Saturday Night Live, a couple of last millennium, not to say last century. Okay, so that's far. We've talked about 2 uses of the lasers. We've talked about question 3 uses: hair removal. We talked about scars. We talked about stretch marks, and we talked about snoring. Other things that lasers can do. These people that have a condition, a medical condition called rosacea. Rosacea is when you look at the skin, there's some melanin, especially you see it more in white people than people of darker skin. And that's one of the things that we can use to treat that area where it looks a little darker than the rest of the skin. And sometimes you may see little capillaries, blood vessel, not so much capillaries because you can't see them, but little tiny blood vessel, little tiny veins running on the skin. And for example, uh, a lot of the time it's associated with, if we remember those people who drink a lot and have a big nose and so on, a lot of the time around that area is you can have rosacea. Since we're talking about rosacea, talking about little veins, lasers are used also to take care of what we call vascular lesions. Like sometimes we have veins in the face, leg veins, veins in the other areas of the body, back, um, birthmarks, what we call the cherry spots, and we can use the lasers to help get rid of those things. And especially if, like for example, on television, you see a lot of people seems to have perfect skin, perfect appearances, and that's because they've gotten these things treated one way or the other. And one way, usually the easiest way to treat them is with lasers. And now lasers are key in terms of taking what we call these vascular lesions. And some people that have varicose veins, you can use the lasers to treat varicose vein. Also, it depends on the matter of degree, because certain veins, the best thing to treat those veins is to use an operation. But the smaller ones, what we call spider veins, that we can see on the legs, on the thighs, and other areas, especially the face, that can the lasers can help in taking care of that. Also, when we talk, as we talked about earlier, acne, there's something called textural irregularities. Texture is how smooth or how unsmooth a surface feels. And usually if you had acne where you have a lot of chronic infections, you may have this, not sandpaper-like, but the skin may have a lot of scar tissue and crevices. And the lasers is a good tool to basically get rid of the surface skin and have it start from scratch, along with other medication. Again, laser is an adjunct to other treatments. Of course, people with acne need to have other medication to prevent and to control acne. You never get rid of acne, you can just control it. And that's also, even as a surgeon, that's kind of news to me. You cannot get rid of acne, you can just control it. And kind of like diabetes and even HIV, you cannot get rid of HIV, you can just control it. So lasers has a role to play in terms of that. Now, as we are in the med spa, we're talking about aesthetics. One of the main uses that we do with the laser here, is we can do a incision-less. In other words, give you a facelift with the laser without doing any incisions in your skin. Traditionally, just as we referred to when we were earlier in an earlier episode talking about how tummy tucks are not being done by fun sculpting. Same thing here. Lasers are used to be doing facelifts. We use different modalities of the laser because different wavelengths of the laser allow you to penetrate different layers of the skin. For example, there's a laser called erbium. Erbium really is mainly used to treat the surface of the skin. And there's another one called Nd:YAG. Nd:YAG goes deeper and to layer of the skin. So we can use the laser to give you a facelift that's very comparable or as good as the surgical facelifts, but again without any downtime and with minimal discomfort and pain. And that usually starts with an evaluation. The evaluation involves getting a history, making sure you don't have certain diseases. For example, we talked about things like scleroderma, which is an autoimmune disease that has a lot of skin component to it. So it's not everybody is a candidate for facelift using a laser, But those that are, again, check with your physician, and it's a lot less costly than a surgical facelift, a lot less pain, and a lot less downtime. That is, you can have a facelift with a laser in the morning. Right after that, you can go to work. You may have a little redness. Some people have a little redness, but you can go to work. In other words, have it during lunchtime and go to work. Now, you probably will need more than one session. It is said that depending on the decade that you are in life will determine how many sessions that you need to get close to that surgical facelift. So that means if I'm 40 years old, I've had all my children, I have some disposable income, and I'd like to feel and look better, and you can go have a laser therapy session. And laser therapy session for a facelift is very, very, very affordable. Please call us for our price. And if you're buying multiple sessions, we will work with you to make sure you are happy, and we'll of course show you before and after. You are happy in terms of the process that you would undertake. But getting back to the procedure in terms of using a laser. Now, if we're doing, let's say, a surgical facelift, they may take fat from other places to inject as fillers. But with the laser, you can use different wavelengths to make your lips look plumper. And they will go a long way towards getting rid of wrinkles and fine lines. So laser can help in terms of taking care of these things. But the facelift is a very, very beautiful thing, especially when it's done properly. And the fact that you don't have any downtime, and that's something you have to calculate into your cost. Let's say I go have a facelift on Friday. Chances are I may have some drains, I may have some pain, I may not be able to go to work until a certain amount of time. But if you have a laser facelift, I just go back to work. So that money has to be factored into the cost. And it's very, very affordable. Most places you'll be able to have a session for less than $1,500. Again, don't quote me. Check on your area, because everything is market driven by the area. Like if you're in Manhattan, chances are it's going to be more than that. If you're in Mississippi, in some Jackson, Mississippi, chances are it's going to be less. So it depends. The area will determine, the market will determine how much you pay for your laser service. But the point is, lasers, because of the new technology, and you can use it to do many, many, many things that you didn't used to do in the past. Now, there's something also called what we call tattoo removal. You can use a particular laser to do tattoo removal. It's use a pico laser, and not all lasers can do tattoo removal. Make sure they use a very, very, very high frequency, very, very short wavelength laser to do tattoo removals. And certain colors are removed easier than others. So please make sure that when you have a tattoo, especially, it's a very in thing nowadays, and some people are very, I would just say, when they fall in love hard. So at the time, whoever they're in love with, they have a tattoo of that person's name or that person's image. Then, as life goes, sometimes they fall out of love, and therefore that person that they've had, they may want that person removed. So this is when laser removal of a tattoo comes into play. So it's very, very important. So tattoo removal is one of the things. And sometimes warts, different warts, different skin lesions, we can use lasers to remove these skin lesions. And or, for example, even nails, I would call fungus in the nails, whether the hand or the feet, we can use lasers to remove that. And also, we do all these things at Elegant Aesthetic Solutions in Chatham, New Jersey. So please call the number that you see on the screen, or go to the website, and we can definitely help you in terms of finding and customizing a treatment for you. Now, We also talked about what's called body contouring, using the laser to do lipolysis, in other words, melting of fat. Yes, if that's what you want, we will do it for you. But in our experience, again, the key word is our experience, we find that fun sculpting for body contouring is done faster and you get better results. Because in fun sculpting, you remove the fat, laser, you melt it. And so, again, in our experience, we find that fun sculpting is better for body contouring. Another thing that we use laser in conjunction with fun sculpting, because sometimes after we remove the body fat from the fun sculpting, it happens that the skin gets a little lax, especially as we do, depending on how much fat we remove. Let's say if we remove, close to the maximum 5 liters of fat, chances are, if you had 5 liters of fat, your skin may wrinkle. So we would have you put a girdle, and then at some point in time later, after you've healed from the fun sculpting, then we will do something called skin tightening, because the skin tightening is also what we do to help the facelift, and also a lot of people with, as we used to call them, turkey necks, we can use the skin tightening to help with that. The word that we use is décolleté, which is a French word, meaning without collar. So therefore, again, one of the other uses of the laser is using décolleté. Now, as we come into an end in this session, I look forward to, with my co-sponsors, to basically share with you more treatments having to do with med spa that will lead to you to feel and look your best. Again, this is Dr. Ducheine. Thank you for sharing this time with me. Until next time, have a great day.